Hello and welcome back to the second episode of AKT Boost, your go-to podcast for all things AKT. I'm Dr. Iain Bolton, a GP Registrar based in the northeast of England and a proud graduate of Newcastle Medical School. You're listening to part 1 of the series on DVLA guidelines. In this episode, we're going to be diving into the nitty-gritty of DVLA regulations concerning cardiovascular and neurological disorders, as well as visual impairments. This is crucial knowledge for both your clinical practice and the AKT exam. So buckle up and let's dive into the essentials. First up, let's navigate the world of cardiovascular disorders and their driving implications. Remember, the DVLA sets different rules depending on whether you're a Group 1 driver, that's a car or a motorcycle, or a Group 2 driver, those who drive heavy goods vehicles or buses. Let's break this down. For hypertension, the rules are straightforward. If you're a Group 1 driver, no need to inform the DVLA, unless your treatment causes unacceptable side effects. However, for Group 2 drivers, it's more stringent. You're off the road if your resting BP hits 180/100 or more. If your patient's had an angioplasty, you're back on the road after a week if you're a Group 1 driver. After a CABG or acute coronary syndrome, it's generally 4 weeks unless you've had an angioplasty during that acute coronary syndrome. Then you're good to go after just a week. With a pacemaker insertion, it's a week off driving. But if you've had an ICD implanted, the rules differ. If planted for sustained ventricular arrhythmia, no driving for 6 months. If it's a prophylactic measure, it's a 1-month break. Group 2 drivers with an ICD, however, face a permanent driving ban. Next, let's talk about aortic aneurysms. Aortic aneurysms over 6 centimeters require notifying the DVLA with annual reviews. Once the aneurysm hits 6.5 centimeters, driving is off the cards. And if you've had a heart transplant, you're looking at a 6-week break before you can drive again, but you don't need to inform the DVLA. Now, let's shift gears and look at neurological disorders. For epilepsy and seizure, all patients must stop driving and notify the DVLA immediately. After a first unprovoked or isolated seizure, driving cessation is 6 months if brain imaging and ECG are normal. Otherwise, it's 12 months. For patients with established epilepsy, they might be able to qualify for driving if they've been seizure-free for 12 months, or if they've been seizure-free for 5 years, a till 70 license could be restored. That is the reinstatement of essentially a normal driving license. For Group 2 drivers, it's slightly different. A person must be seizure-free for 10 years without medication before a license is considered, or if an isolated seizure occurs, a 5-year seizure-free period is required with no medication. If patients are coming off their epilepsy meds, there's no driving during the withdrawal period and for 6 months after the last dose. So it's important to counsel patients on withdrawing their medications in case that affects their independence. Let's not forget about syncope. For a simple faint, you're in the clear. If you've had a single explained and treated episode, you're off for 4 weeks. If it's unexplained, that's 6 months, and if there are 2 or more episodes, it's 12 months off driving. For Group 2 drivers, the rules are slightly different. If they have vasovagal syncope, they must not drive for 3 months and must notify the DVLA. For unexplained syncope, drivers must not drive for 12 months if no cause is identified. For strokes or TIAs, the rule of thumb is a 1-month break if there's no residual neurological deficit, but multiple TIAs over a short period will require 3 months off and DVLA notification. Again, for Group 2 drivers, things are stricter. If they suffer from a stroke or a TIA, they must not drive for a year after the event. Licensing may be considered after that year if no significant risk factors are present. Last but not least, conditions like narcolepsy or cataplexy, you must stop driving immediately upon diagnosis and can only restart once symptoms are satisfactorily controlled. For Group 2 drivers, they also require 3 months of symptom control and regular specialist review. They must complete a driving assessment. This is mandatory. Finally, let's focus on visual disorders. Another critical area for both your clinical knowledge and the AKT. The DVLA have specific guidelines based on the type and severity of visual impairment, taking into factors like visual acuity, visual field, contrast sensitivity, and any other issues that could impact safe driving. Let's break it down. For visual acuity, the standards differ depending on whether you're a Group 1 or Group 2 driver. For Group 1 drivers, that's the cars and motorcycle users, you need to have a visual acuity of at least 6/12 on the Snellen chart, using both eyes together with corrective lenses if necessary. Plus, you must be able to read a number plate from a distance of 20 metres in good daylight conditions, just like we needed to do when we passed our tests. For Group 2 drivers, that's those driving buses or lorries, the bar is set higher. You need at least 6/7.5 in the better eye and 6/60 in the other eye. Again, with corrective lenses allowed, but within certain diopter limits. Also, an adequate field of vision is a must. Now, what about visual field defects? For Group 1 drivers, you need a horizontal visual field of at least 120 degrees with 50 degrees to both sides and no significant deficit with 20 degrees of central fixation. Any issues like homonymous or bitemporal heminopias or significant quadrantinopia are disqualified for driving. For Group 2 drivers, the requirements are even stricter. Any visual field defect that affects safe driving or indicates significant field loss is generally disqualifying. Regular field of vision assessments may also be necessary for conditions like glaucoma, where progressive field loss is a concern. Let's look at some specific visual conditions and their impact on driving. Monocular vision, when you only have vision in one eye. As a Group 1 driver, you can still drive if you meet the visual acuity standard with the remaining eye and have adapted to the vision loss. Typically, an adaptation period of at least 3 months is required to ensure you've adjusted. But for Group 2 drivers, driving is generally not permitted due to stricter visual requirements. Diplopia or double vision for Group 1 drivers, you must stop driving until the diplopia is controlled or treated, and the DVLA must be notified. Patients can resume driving once the condition is satisfactorily controlled, but an adjustment period might be necessary. For Group 2 drivers, again, the rules are even tougher. Diplopia must be adequately controlled and regular reviews might be needed to maintain the license. Let's move on to cataracts. If you're a Group 1 driver and your visual acuity meets the standards, there's no need to notify the DVLA. However, if cataracts cause your vision to drop below required levels, patients are required to stop driving until surgery is performed or the vision improves. For Group 2 drivers, if cataracts causes their vision to fall below the required standards, they must stop driving and notify the DVLA. Driving can only resume if visual standards are restored after treatment. Glaucoma. As a Group 1 driver, you must notify the DVLA if glaucoma affects both eyes. If only one eye is affected, the other eye must meet the standards. They may continue to drive without notification. For Group 2 drivers, they must notify the DVLA if glaucoma affects either eye and regular field vision assessments are required. For conditions like retinitis pigmentosa or diabetic retinopathy, Group 1 drivers must notify the DVLA if there is a significant visual impairment or progressive vision loss. Regular assessments may be needed to ensure continued fitness to drive. For Group 2 drivers, the standards are higher. Shock. Any progressive visual loss could lead to disqualification from holding a Group 2 license. Let's talk about macular degeneration. If you're a Group 1 driver, you can drive if your visual acuity meets the standards and there's no impact on central vision that would impair safety. However, for Group 2 drivers, macular degeneration is generally disqualifying if visual acuity is below the required standard or if central vision is significantly impaired. One last thing to mention would be visual inattention or neglect. This condition is disqualifying for both Group 1 and Group 2 drivers. If patients have clinically apparent visual inattention, they must not drive and must notify the DVLA. Now, that's a lot to take in, but understanding these visual disorder guidelines is essential for both safe practice and your AKT success. Alright, let's break down the most important facts you need to know from today's episode. Focus on the specifics that are crucial for both your AKT exam and everyday clinical practice. For hypertension, Group 1 drivers can continue driving unless treatment causes side effects with no need to notify the DVLA. Group 2 drivers are disqualified if resting BP is consistently 180 over 100 milligrams of mercury or more. Elective angioplasty requires 1 week off driving for Group 1 drivers. If treated for an ACS, it's 1 week off if angioplasty was successful, otherwise 4 weeks. After pacemaker insertion, it's 1 week off driving for Group 1 drivers. ICDs fitted for ventricular arrhythmia, it's 6 months off driving for Group 1 drivers, and 1 month off if implanted prophylactically. ICDs mean a permanent disqualification for Group 2 drivers. For visual field defects, Group 1 must have a horizontal visual field of at least 120 degrees, with no significant defects within 20 degrees of central fixation. Conditions like hemianopia or significant quadrantinopia disqualifies driving. Group 2, stricter standards, any defect that affects safe driving is disqualifying. For special conditions such as monocular vision, it's acceptable for Group 1 if the remaining eye meets acuity standards and the individual has adapted. For diplopia, that requires cessation of driving until it's controlled or treated, and the DVLA must be notified. For cataracts, no need to notify for Group 1 unless visual acuity falls below standards. For Group 2, notification is mandatory if standards aren't met. The most important facts to recap: know the key timeframes, so 1 week for angioplasty, 4 weeks post-CABG, and 6 months for ICDs. Seizures and epilepsy, at least 6 months seizure-free for Group 1, 10 years seizure-free without medication for Group 2. And for visual disorders, always check the visual acuity and field standards are met, notify the DVLA when in doubt, especially with progressive conditions like glaucoma or retinal disorders. Keep these specifics in mind as they can come up in the AKT and are essential for patient care. Now let's test your memory with 10 short questions. Question 1. What is a blood pressure threshold for disqualifying a Group 2 driver from driving due to hypertension? A resting BP of 180/100 or more. Question 2. How long must a Group 1 driver refrain from driving after an elective angioplasty? 1 week. Question 3. After an ICD implantation for sustained ventricular arrhythmia, how long must a Group 1 driver cease driving? For 6 months. Question 4. How long after medication withdrawal must a Group 1 driver with epilepsy be seizure-free before they can resume driving? 6 months. Question 5. What visual field requirement must Group 1 drivers meet to be eligible to drive? A horizontal visual field of at least 120 degrees with no significant defect within 20 degrees of central fixation. Question 6. Can a Group 1 driver with monocular vision continue to drive? And what is the condition? Yes, they can drive if the remaining eye meets visual acuity standards and they have adapted to the vision loss. Question 7. What must a Group 1 driver with diplopia do before resuming driving? They must stop driving until the diplopia is controlled or treated and notify the DVLA. Question 8. How long must a Group 1 driver refrain from driving after pacemaker insertion? 1 week. Question 9. What are the visual acuity requirements for Group 1 drivers? Visual acuity of at least 6 out of 12 on the Snellen scale using both eyes together with corrective lenses if necessary. Question 10. When must a Group 2 driver with glaucoma notify the DVLA? They must notify the DVLA if glaucoma affects either eye. For an added bonus question, can Group 2 drivers with night blindness continue to drive? No. Night blindness is generally disqualifying for Group 2 drivers due to their higher safety standards required. These questions should help reinforce the key facts you need for your AKT preparation. And there you have it. a dive into the DVLA's driving guidelines for cardiovascular, neurological and visual disorders. I hope today's episode has helped clarify some of these complex rules and given you a solid base for your AKT revision. If you found this podcast helpful, please take a moment to like, share and review the podcast. It really does help us reach more people. And don't forget to follow us on Instagram at AKT Boost for more tips, updates and handy revision guides. Remember, keep your eyes on the road, both literally and figuratively, as you navigate your way through your AKT prep. I've been your host, Dr. Iain Bolton, and remember, when it comes to DVLA guidelines, don't let your knowledge take a back seat.